Well, as you can see, the North Central Health District is running a COVID vaccine clinic here at the Senior Center. Now, they had 240 slots available, but only 93 people were able to sign up on their own. And the town says it's not because of a lack of demand, it's because of a lack of functioning systems. The town of Vernon is the first to publicly rebuke the state in its Phase 1B vaccine rollout.
Frustrated, angry, and are confused by the ineffectiveness of this registration system that's been put out by the state and federal government.
The state says the biggest problem is vaccine supply.
There's one choke point, we need more vaccines.
Vernon rebuts that.
The biggest barrier that we are facing right now is not the supply of vaccine locally, but the accessibility and user-friendliness to the registration system that's online and the telephone number that's also been provided to our residents.
The town of Vernon says they've had to circumvent the state hotline and the VAMS system to get people signed up manually, establishing their own call center. We asked seniors, could you figure it out on your own?
Probably not. I hadn't read any fine print about how some of the other towns had done things.
Personally, I don't know that I would have recommended for my grandmother to do it herself.
The state acknowledges that their phone hotline isn't perfect. For one, it only books appointments right now at Rentschler Field.
We have been working with providers across the state to add, what we call inventory, right? Appointment slots to the group that's answering the calls on that call center line so that they can start booking people into other parts of the state as well. So that's happening as we speak.
The online VAMS system is a federal portal, not run by the state. But the state says they've been relaying feedback about its lack of access for people who speak other languages.
It is a known shortcoming of that system, and it is one of the main reasons we prioritize getting that call center set up. As you know, through 2-in-1 Team, they have multilingual support.
The state says they are continuing to improve access as they go, but many seniors are frustrated and confused. The state has asked for patience. Right now, Connecticut's getting about 50,000 doses a week.
Could I use 5 times that amount? Absolutely. Do I hear from hospitals every day, give me more? Absolutely.
Now, in a little good news, the state did just get an extra 50,000 doses of the vaccine for being one of the top 5 vaccinators in the country. And if the Johnson & Johnson vaccine gets approved within the next few weeks, you can expect the rate of vaccination to ramp up. Reporting in Vernon, Matt Caron, Fox 61 News.